Welcome to UltraLife Today. I'm Josh Bellew, one of your hosts. I'm here with my dear friend Adam Payne, CEO and founder of Ultra Botanica. We have a wonderful guest for you today. It's going to be interesting. Do any of you ever experience pain in your body? Have you ever sought relief and just couldn't find it? Have you ever sought relief for persistent forms of pain that there just doesn't seem to be any answer for? Well, Adam, today we've got someone who's been a friend of ours for many years now, Dr. Robert Odell. He is the Neuropathy and Pain Centers of Las Vegas. I believe the owner and maybe even the founder.
I don't know. I think these are great questions we can ask him. Dr. Odell, how are you today?
I'm doing great. Thank you very much.
So tell us a little bit about your story, Doc. How did you end up being a neuropathy and pain specialist? I'm sure you didn't wake up. I'm imagining, kindergarten, scroll back maybe 60 years ago. And the kindergarten teacher got up and said, "Okay, kids, it's show and tell time. You tell us, what do you want to be when you grow up?" And I'm sure you didn't stand up and say, "Well, Mrs. King, I want to be a pain and neuropathy specialist."
We'd love to know how you got to doing what you're doing, because there's so much fascinating information on your website, Doc.
Yeah. So what was it? How did you get to where you're at?
I went
today?
to college. I was an engineer. I wanted to do engineering. My dad was a well-known football coach and an All-American football player and America's outstanding player in '43. But my junior year, I went over to Scotland, and one day I walked down and said, "I want to be a doctor." And the next day I walked down from the dorm and said, a couple of weeks later, I'm going to go to Stanford. I was lucky enough that both those worked out.
Wow.
Fast forwarding, I liked the technical aspects of anesthesia and got interested in anesthesia, and particularly liked regional anesthesia, using needles. So I started practicing in 1982, but in 2001, I began taking the ISIS courses. That's not the terrorist, but the International Spine Intervention Society. Essentially learned on the weekends to do a lot of these fancy blocks, many, many weekends, and much training and much time spent. And over the years, it's evolved. I became acquainted with RST Synexus, which the founder of which developed this advanced electromedical device called Synexus. And what this thing can literally do is heal nerves. And over the course of the years, we developed essentially a cure for neuropathy. The challenge is Medicare won't pay. Yeah. Oh, yeah. We can use this device on people's feet and really improve their neuropathy, incredibly improve it. And unfortunately, Medicare will pay for the machine, but they won't pay for the blocks that we have to use. It's kind of a long story and outside the scope of this, but we're plodding along and helping a lot of folks with that type of neuropathy, distal symmetric neuropathy, as well as a reflex sympathetic dystrophy, CRPS, things like that. All sorts of things. I also do, of course, the interventional pain management. We put in stimulators, epidurals, all sorts of things.
So as somebody who suffers from progressive chronic neuropathy, I have something that I guess you'd call it Charcot-Marie-Tooth syndrome. You familiar with that?
Yeah.
Yeah. So it's mine is non-classical. In other words, I don't. There's no genetic markers for my particular classification, but I have the focal, the muscular degeneration. I have the classic symptoms of the high arches and the progressive nature of degrading nerve signals going from my periphery, slowly coming into my center. What kind of hope is there for somebody like me?
Well, we actually can help almost everybody with any form of neuropathy. I think we've had a few CMT patients, and some have done fairly well. It's a little easier to do standard neuropathy, where it's mostly just sensory. We can reverse a foot drop, but the thing about it is, it's a series of 3 treatments a week for several months. So It does involve some time, but there's no risk unless we drop the machine on your foot. I mean, it's incredible. If I spend half my time telling people about UltraCure and the other half telling them about the EBM company, which makes a medical food company that makes B6, B12, and folate, which is FDA regulated and is the best bang for the buck in terms of helping the nerves to grow, neurotropic. This is what I'm talking to them about supplements. So it really works. There's some we get great success stories. Would be better if we could be doing the injections. A lot of people get more better, but unfortunately, that's Medicare for you.
So let's take a couple of steps back, and would you mind telling us how you even got interested in neuropathy? What was your aha moment when, as a physician, or maybe even before you were a physician, what was there a life event that happened that got you interested in the whole thing of pain and neuropathic syndromes?
Well, no, I met Dr. Sonyard, and I became interested in the Synexus device, which is the most advanced electromedical device on the market, and it can basically heal the nerves.
Okay.
Nerves may be healed. The medication management for neuropathy is terrible.
There's
terrible. Papers back in 2011 by Dr. Brill and others, and what we actually do is we actually heal the nerves. We have a paper on the anti-inflammatory effects of electronic signal treatment that is in the peer-reviewed literature, and the list goes on and on and on of how well it does. It just has not been widely accepted. It's being done by a lot of people. There's billing challenges and all that stuff, but
sure.
I became interested in neuropathy because of my association with Dr. Sonyard and this electromedical device.
So what is the device? So what does the device do? I mean, I think about nerves. I'm thinking about a pretty long and the sensory nerves are shorter, right? It's the long fiber nerves that kind of go all the way up the spine to the root, what do you call it? The brain stem.
Dorsal root ganglia. Now, all the nerves are the same length. No, the peripheral nerves are the same length. Then they synapse in the spine, and the second order neurons go north. But the motor and sensing nerves are the same length. Other motor nerves might be a little shorter because it depends on where the motor end plate is. But this treats all of them, gets them all better. I mean, it boosts the circulation, boosts the immune system. It shakes the cells so fast it increases the interaction of the molecules.
Wow.
It has a profound anti-inflammatory effect, neuromuscular re-education, and a host of other things. And
so is this kind of I know that there's like electrical stimulation devices, like TENS devices, and then there's these more advanced, higher frequency electrostimulation kinds of devices. Is this device that you're talking about in the same class of what other people have been doing, or is this a different principle?
Well, it's the same. It's classified as a TENS device, neuromuscular re-education, and interferential. But in fact, it's electronics. That's for FDA approval. But its electronics are way, way more sophisticated. There's really nothing like it. A lot of people claim that there is, but there's really nothing like it. It has carrier frequency scanning. For example, it'll go between 8,333 and 10,333 hertz. And in that sequence, cyclotron resonance theory tells us that the nerve will resonate with one of those frequencies, somewhere in between. So when it has a dwell time of 2 milliseconds, all right, the mitochondria will take up that energy, much like the Galloping Gertie Bridge in Washington many years ago.
Oh, interesting. So you create a resonance in the nerve does that break up? So
takes up energy.
Help us understand.
No, it heals it. It takes up energy, and the nerve can heal. I mean, even though I'm 75, I don't know how old you guys are. We still can heal very well as older folks. Younger people can heal probably a little better, but if you didn't heal, you wouldn't be alive. And we are healing people's nerves, to a certain extent.
So we learn a lot from we've had I don't know if you know Dr. Joseph Parita and his work with stem cell research down in Florida. We've had him on the show, and he's talked about mesenchymal stem cells and all of these different kinds of replenishing stem cells in the body that, when activated, can activate different healing processes in our body. Are there different cells that kind of co-host or cofactors in the healing mechanism of nerve cells, or is it just all nerve cell centric?
All cells respond to electricity. Our body runs on electricity. If we eat something or drink something or think something, it becomes an electric current. We just access that directly. And I wish I'm not at work now. We were off at 1, but I have I could show you the 3.5-inch electrodes that go right on the body. And these electrodes, there's 4 electrodes per channel, two circuits, and they can either work in an interferential or usually it's an additive manner, and put the current right where it needs to go. The higher the frequency, the deeper the energy will go. So it's one form of energy healing, and I think it's probably the most effective because the body runs on electricity. It really does. Sure. That's how nerves, as you may or may not know, can conduct impulses both directions. Usually it just conducts in one direction, but they conduct in both directions. But this also works directly on the tissues to heal nituses of infection, things like that, and it helps the nerves to basically regrow, regenerate properly.
So go ahead, Josh.
I'm kind of dumbfounded. This is amazing stuff, Dr. O'Dell. So for a person that is there a typical thing as it would relate to diabetic neuropathy? And if that's the case, is that one of the easier challenges that you all face when you're utilizing these sophisticated machines? Or is that just like...
It works on all of them. It works on all neuropathies the same way because the final, just like the shock lung, the final common pathway of the lung when it's insulted, it can only really be one thing. That's ARDS in adults. It's the same thing with the nerves. They respond one way. Now, there are some subtle differences or not so subtle differences with the attacking of the myelin sheath versus the nerves. And of course, the C fibers have no myelin sheath. I'm not really an expert in that, but I do. My forte, my wheelhouse is actually doing the treating. And because this is so risk-free, we can really, we have a carte blanche to experiment on people. I hate to use the word experiment, but a certain program doesn't work, you try another program. We go through 8 weeks of different programs or different combinations of treatment. One easy way of looking at it is if you have foot drop, one of those treatments is neuromuscular reeducation, where we put a 30 hertz signal through the peroneal nerve, which is the signal that it usually uses to fire the ankle to raise, and that helps the nerve to recover, regenerate.
Oh, interesting. So you're re-educating and strengthening and reinvigorating that nerve, those nerve cells all in one go. So when you're saying experimenting, though, you're really saying that you don't know exactly which protocol is going to have the most benefit. So you're trying different things, and usually one of those paradigms or one of those treatment modalities works for somebody.
What we do, we use a protocol according to what the patient's problem is. There's a Cribs protocol. Okay. There's a diabetic neuropathy. There's a non-diabetic neuropathy. There's protocols for acute pain, protocols for example, inflammation. We have an AI protocol, like for carpal tunnel. We might put the anti-inflammatory over that because it's the inflammation around the median nerve, et cetera, et cetera.
Interesting.
And it's a sequence of 8 programs, and those are all developed by Dr. Sonyard, and some of them have basis in, solid basis. Others are just kind of what's worked in the past. It's like anything else. We don't have a whole lot of money behind us to do the research, unlike the drug companies and the spinal cord stimulator companies. That's the problem. And that's why we're constantly getting beat up by Medicare and, not wanting to pay for this, that, or the other thing. Blue Cross is after me now for the use of 97032 attended stim. And Blue Cross is not a big payer out here, but they want $15,000 back. It's going to cost me that much to tell them they're full of, what, which they are.
Goodness.
It's really sad. I mean, a friend of mine, Ralph Weber, you want to interview somebody interesting. Ralph wrote the book Rigged, How Insurance Companies Have Ruined Healthcare in this country with the help of the politicians.
I believe it.
On both sides. But Ralph is a very interesting guy, and I count him one of my best friends. He's an insurance genius. Whatever you're paying for health insurance, he could probably get it to you for a third. But that's another story. But I mean, it's
you think about it. Insurance companies, their interests are not aligned.
What's that?
Insurance companies' interests are not aligned with the interests of the patient, nor the interests of the doctor.
Nope.
No, not at all.
So you've been listening to Dr. Robert O'Dell of Neuropathy and Pain Centers of Las Vegas I'm Josh Bellew. This is Ultra Today. I'm sitting here with Adam Payne. We're going to take a quick break, and we'll be right back.
Yeah, thanks for joining us.
We are back, and this is UltraLife Today. I'm Josh Bellew, sitting here with CEO and founder of Ultra Botanica, my dear friend Adam Payne. And we're getting acquainted today on a different level with Dr. Robert Odell from Neuropathy and Pain Centers of Las Vegas. He's been someone that Adam, I think, connected with years ago, and he began to use the UltraCur products in his practice. But we have just been blown away today listening to him talk about the unique interventions they can do for nerve pain.
Nerve pain. And Dr. Odell, you don't know me. I mean, I've literally been suffering with profound nerve issues for the last decade. And so I'm going to come up and visit you because I want to get treated by your stuff. Obviously, it might be a little bit difficult for me to be bouncing back and forth. The Las Vegas, Southwest Airlines has a direct flight going to Las Vegas. I can probably get like a $70 round trip ticket and come up there and see you and get taken care of. How does that sound?
Good. Love to have you.
So before we take a deep dive, I want to let people know how they can get a hold of Dr. Odell.
Yeah.
The website is NV, like Nevada, the state of Nevada, nvpainrelief.com. You can go there, you can request an appointment, you can meet the staff, and then also there's a phone number you can call. It is area code 725, and that's 373-9879. That's 725-373-9879, or go to nvpainrelief.com to meet these fine people and learn more about what they do.
Yeah, it's exciting. So when did you become acquainted with UltraCur, Doc?
Well, I'm interested in lasers. I'm interested in all sorts of energy medicine. And I went to the Weber seminar with a green laser, the people from Germany, and I met you. I said, I think I might try that stuff. I think it took me a few months. And honestly, it took a month before it worked. I know your formulation tends to work sooner. We had a lady that worked in 2 days, and I know we've been giving out those samples. But I tell you, I have so few aches and pains. So I'm 75. I played football. I played everything in high school, football and college. I ran my whole life. I started using exercise devices 15, 20 years ago. My dad had 4 total joints. My sister has one of them has 3. Nancy has 1 total hip. I've probably been spared a little bit. But other than, like, if you can see this little finger here, it's red a little bit. I have probably pseudo-gout there. If I get that over top of taking the UltraCure, I'll take an naproxen or 2 and it goes away. Wow. Every once in a while, one joint, pseudo-gout is forget the chemical. My uric acid is normal, but one joint will be inflamed. Every once in a while, to be fair, maybe once a year, once every 8 months, I may have to inject it. I had Achilles tendonitis on myself, and my PA and I put what you do, you do a hydrodissection with a low dose steroids, a little bit of lidocaine and normal saline. That fixed it right away. So not 100%, but it is. I can't, except for this little pinky. I toured around Switzerland for two weeks, and no problems at all. In fact, I do distinctly remember sometimes when I've run out of it, and things have started to hurt. And rather than taking the naproxen, I just took it again. I took the product. I mean, the fact that it has one thing about my Synexus I love, there's no risk unless you drop the machine on their foot. Okay. We've had a few burns, to be fair, but rarely. Same thing with UltraCure, except for the bleeding issues.
Right.
Which, and those people, but there's no risk. I mean, kidney, stomach. I mean, the NSAID, it's just ridiculous. It's ridiculous. You guys know, in my AI paper, I discussed this. You might want to read that, but Howard Hughes died of NSAID toxicity.
He did.
That's what he died of. Yeah.
And this is because of bleeding that happened in his stomach, or is this something else that happened? Kidney issues.
Failure.
Yeah. Oh my gosh.
Yeah.
I mean, I know that people that prior to using UltraCur, we know so many people that were saying that they were chewing on ibuprofens like they were candy. In fact, I heard that the special forces, they call ibuprofen they call it candy because they're eating it all the time.
Wow.
Because of the pain and the torture that they put their bodies through and the accumulated damage that they've had in their bodies. You know, curcumin, we've studied curcumin for a long time, as you might imagine, Doc. And curcumin is one of the only substances that we found that actually encourages a transition from the attack inflammation to the rebuild inflammation. So from the Th1 response to the Th2 response. And that has to do with activating mesenchymal stem cells and deactivating the attack kind of inflammation that happens through IL-6 and IL-8, IL-17, IL-23, and turning on those rebuild signals that only come after the body has determined that the fight is over. And, you know, when we have these worn out joints in our body or worn out ligaments or tendons, the body can't differentiate that overuse of a worn out joint as an attack. So it comes in there guns a-blazing, and it takes time for the body to say, well, there's not really a fight here. I just need to rebuild it.
You need to look at our paper, the AI paper. That's what Dr. Sonyard and I said, is that the electricity probably accelerates the pro-inflammatory briefly and goes into the anti-inflammatory mode to work exactly as you described from an electrical standpoint.
Yep. Dr. Parita, who is a stem cell orthopedist, he also found our stuff at one of Dr. Weber's conferences. He pre-treats his patients with UltraCur Pro, because he says that it helps to create an environment in the tissues where he is activating stem cells to be receptive to the rebuilding inflammatory response.
Yeah, when I was out at the International Society of Laser Applications conference, Dr. Odell, I met many, many doctors that from the stage, one particular out of Alaska, that said he always has his patients taking UltraCur Pro before they come in, about 40 minutes before he does any laser applications on them. And it's a beautiful photosensitizer, I guess.
So what are you seeing in your patients in terms of response with UltraCur? When do you recommend it to them?
All the time. The ones that'll take it, they sing its praises. Of course, they come into me with an acute problem. I may have to fix a facet problem with neck or back with, I use an advanced radio frequency needle. And, but, for controlling systemic aches and pains, everybody that takes it loves it. Now, I will say this, I probably don't recommend it for younger people. I'm not sure. I just don't know how much they need. I mean, if you guys could educate me on that, but I think for people that are older, it's certainly indicated. I also take the vitamins made by Pharmanex. They're profoundly profoundly antioxidant. My antioxidant score was low when I was first tested. So that and UltraCure are my two go-tos. The Pharmanex I strongly recommend. We have a machine that actually can measure your antioxidant through measuring carotene in your skin, and my score is steadily rising. But and so those supplements and UltraCure are the ones I take. Now, you and I both know that a lot of this stuff is just not regulated. People can say anything.
That's true.
And even people that are esteemed or supposedly esteemed will say anything because they get a buck.
Right.
But this is one product where I'm pretty healthy, but this is one product where I have personal experience. Be quiet. I'm on the radio. It's my dog.
So Dr. Odell, what are the types of diagnostic testing that you might do when you're looking to recommend supplements, such as you do things with vitamin B and vitamin E deficiencies and other things. What are the diagnostic tests you do to determine a person's vitamin levels?
We have a lab that does our urine drug screening that has some testing, and we're going to start doing it because Medicare will, in fact, pay for the CYP series to see what medications people should and shouldn't be taking, which one are metabolized.
Oh, interesting.
Really, for UltraCure, what I do mostly is just somebody that comes in with inflammation. And by the way, a lot of people think that inflammation is a cause of all pain. I don't know if you're familiar with Soto Amigui. I've never met him. He's out of L.A. And he writes a lot about pain and inflammation. Some people think that the cause of neuropathy is inflammation at the cellular level, microinflammation, which the device will help with. I normally don't prescribe UltraCure for neuropathy, however, because we're using the medical device, and I try to get them on the neurotropics, EBM products, the B6, B12, and folate. There's only so much that, of course, people will afford, and of course, economics I find is the biggest barrier. It's just really a shame.
Yeah.
But to answer your question, I don't really use tests. I just do it clinically because most people come to me. Most of the pain is caused by inflammation.
Yeah, and ironically, and I think you're speaking to your point, UltraCure does nothing for my neuropathy. I can take high doses of UltraCure when I'm having a flare up, and it does nothing for my pain. But for my joint dysfunction, my arthritis, I play worship music in a church here, and I have a big 12-string guitar. In fact, it's right over there. And if I have issues with my left hand, and the 12-string guitar, it's like it's 2 strings per note. You have to put a lot of pressure on it. If I forget to take UltraCure right when I start, I can maybe play for 15 minutes before the pain is unbearable. But if I take UltraCure right when I start playing, Doc, I can play all night without any issues going right through. It's amazing.
I believe you.
Yeah.
Do you get it for a good price?
I do.
I get it for a great price, actually. I really do. Yeah. Great question.
Free. Well, it's not free. Essentially it is coming out of the pocket.
I treat them for free because Medicare won't allow you to bill for your own family members.
There you go.
Right.
So I treat myself. I don't trust anybody else.
Hey, so, Doc, if I wanted to come up and get treated for my neuropathy, how many sessions do I need to come up there and in order to get started?
Well, we just stay as long as you can, a couple of weeks, and see what you do. And if you're motivated, maybe there's somebody with a Synexus device near where you are. Maybe there's all kinds of things that we can do. I can introduce you to Dr. Sonyard down at Synexus and tell them about your product. Because what I'd like to do is figure out some way of getting UltraCure more utilized around the country without spending $5 million in ads. Unfortunately, that's the way things work. And I see some of these ads, some of the stuff on television, and I just want to throw it up. But
there's a lot of stuff that doesn't work that well that's being pushed out there, and it's unfortunate. We're the only company that I know of that gives away free samples of product to people so they can try it and see for themselves. And we believe in that.
Yeah, but I still think some people it does take longer. I get you, but for me it was 3 weeks, and all I can look at is an N = 1.
I agree. I agree. Josh, it took like 5 days. Right?
5 days for me. Yeah. And it was miraculous on the 5th day. It was
like
something. It was just the pain was gone that I had dealt with for 5 to 6 years.
Interesting.
Well, if I can help you guys, any conferences or anything, because here's the thing: maybe naproxen and that other stuff works as well. Fine. But there's no risk. And in fact, I would sometimes almost rather give somebody hydrocodone 5 or 10 milligrams than NSAIDs.
Really?
Think about it.
Just because of the cost risk issue?
Yeah. The benefit risk issue, not the cost.
So we're going to take a quick break again, Dr. Odell. I want to let you all know before we go to break how you can reach Dr. Robert Odell. It's N as in Nancy, V as in Victor, nvpainrelief.com. He's got a really interesting staff of people that he works with as well. And the phone number to reach him at is 725-373-9879. That's 725-373-9879. And this is Neuropathy and Pain Centers of Las Vegas. And this is Ultra Today. Adam,
UltraLife Today.
UltraLife Today. We're going to be right back.
Yeah, we'll see you soon. Thanks.